Now joining Kathleen on stage, please welcome our panel of experts. Melissa Bartlett is the SVP of Health Policy at the ERISA Industry Committee, or ERIC, which helps America's largest employers shape benefits policies before those policies shape them. Nancy LeaMond is EVP and Chief Advocacy Officer at AARP, the sponsor of today's program. And Lance Robertson, a partner at Guidehouse and former Assistant Secretary for Aging at the Department of Health and Human Services. Welcome.
Welcome, Melissa, Nancy, Lance. Thank you so much for joining me this morning. Nancy, I want to start with you. AARP just recently released a new state-by-state report, not only looking at caregiving, but the enormous financial toll that it can take. What findings would you say you found to be the most urgent?
Well, I think the overwhelming finding is that 80% of all family caregivers, and there are about 63 million in this country, say that they are investing resources in taking care of their loved ones.
Well, like Gary described, what did he say, $7,000, $8,000?
Absolutely,
right?
Around
a year,
$7,200 a year, and it's ongoing. It's ongoing, and we also know that it's taking a financial toll on them. As we talk to people, they're not saving as they pay this money for their loved ones. They're going into debt. They're worried about their retirement. They're worried about their health care. And I think we were very, very struck by that. We've done a lot of studies that show the strain and the challenges on family caregiving, but this really highlighted for us the financial challenges, which everybody who's preceded us talking this morning has mentioned.
Lance, back in 2017, as part of the RAISE Act, you helped craft something called the National Strategy to Support Family Caregivers. Now, I'm one of many who probably didn't even realize we had this national strategy. So would you say that you are you satisfied with the progress that has been made since then? And if not, what has prevented it from having more impact?
Yeah, great question. Hopefully everyone listening has familiarity with the RAISE Act and the 350 recommendations that came out of that with the national strategy. You'll do well on the quiz we're about to pass out. I do think, though, Kathleen, we've made great progress. Are we there yet? Of course not. Will we be there soon? I doubt it. But I do think, given the enormity of the issue we're talking about, family caregivers, this is not something that will be conquered in the next day, week, month, year. This is an ongoing, evolving issue that we all have to commit to. I do think that the RAISE Act, some of the real highlights of that work that I always will cherish is just the bipartisan approach of it. You heard today from members of Congress. This is really an apolitical issue. This is not something that has to be wrapped in politics. This is something as a country everyone is impacted by. Therefore, everyone needs to step up and play a role. I love the fact that there are 15 or more federal agencies involved. The federal government is a big partner. The federal government should not be considered the only or primary partner, but I do think they can really incentivize and push certain things forward. And, I think that despite just the natural occurrences in DC with administrations, we continue to see momentum moving forward. I know the current leadership at the Administration for Community Living, and speaking with them yesterday, they're getting ready to relaunch RAISE and keep it pushing forward and doing great things. So I do think we have some wonderful opportunities ahead. Everything that we hear discussed in terms of supporting caregivers has value. I do think, though, this is the time where we have to really take the conversation to the next level. Based on the data and what we know, how do we then wrap around our efforts in a way that are much more technology-driven, innovative, creative? How can we really bend the curve in a positive way that isn't just reliant on what we have traditionally come across as solutions?
Melissa, employers are very much a part of this discussion because some 2/3 of caregivers actually have jobs. Isn't that amazing? As they are taking care of their loved ones. Yet only about 1/4 of workers in the United States have paid leave. So when employers want to do more to help their workers who are in this pinch, what roadblocks stand in their way?
So thank you for having me, by the way. I'm with the ERISA Industry Committee, otherwise known as ERIC, and our member companies are the largest employers in the country. They have benefit designs for retirement, healthcare, welfare benefits for a nationwide workforce. So clearly they are trying to meet the needs of their workers in terms of recruitment and retention, keeping them happy, keeping them healthy, and supporting them as caregivers. And so the key question here is, and paid leave's a component perhaps of how they design their overall benefit program to meet those needs. But I think the key question is how can employers afford not to do anything on caregiving support when you think about that, right? It has significant impacts, like I said, on retention, engagement, productivity. These are all things that employers know and recognize and want to be part of the solution. And I'll say there was a Mercer 2025 report, since you mentioned the 2/3. These numbers to me were just staggering, that caregivers represent about 47% of employees in the U.S. That was from a Mercer, did a report this year, 2025. Roughly half of the caregivers really, are stressed in everyday life of those employees, about 49% of employees, and about the same, feel the same stress most days at work. 9 in 10, so 86% have delayed their own health care in the past 12 months. Also, like you said, 2/3 or 69% say they're thriving in their current role, but they're keen to pursue further sort of training opportunities. So there is an investment component there that employers have in their employees, right? They want to stay employed, they want to grow in their professional life, but they're balancing it with their personal life as well. And so, like I said, employers, what our large members have done is there's no one solution for all employers. What they need to do is have as much flexibility as they can so that they can listen to their employees and design the benefit that their employees need regardless of where they are in the country. And that's a whole host of solutions. I think you touched on technology and AI and the promise that has. Obviously, telehealth. Right. We've seen an explosion in the use of telehealth to meet the worker or the worker's family where it's best for them to access care, potentially. There's obviously all kinds of financial and work flexibilities that employers are implementing today, whether it's hybrid work, remote work, some tied to folks that are new parents, some tied to folks who have recently encountered elderly caregiving situations in their lives. Large employers have that flexibility to meet the employees where their need is, but they need it. They need to protect it, and they need the room to sort of build those benefit designs around their particular workforce.
Nancy, speaking of solutions, we heard the lawmakers at the top of the show. They had a lot of different ideas. It does sound like there is increasingly a bipartisan consensus on this. Is this something new? If so, what has changed? And if this is a new momentum, then how do we seize this to bring these measures across the finish line?
Well, we're seeing increased interest and activity now at the federal level. About 12 years ago, AARP did something most big organizations never do, and that's we went and talked to thousands of our members about their lives, and what we found was family caregiving was a huge issue. And it wasn't an issue that came up in our polling and things like that at the time, because people weren't talking about it very much. And so we put together a plan to begin in the states. Our first big victory was in Lance's home state of Oklahoma, where we passed the CARE Act, which requires hospitals to identify caregivers as somebody comes in and is later discharged. And over the years, we've seen bipartisan, bicameral support across the country, red states, blue states. And we were encouraged by this. And now, thanks to Lance and his team starting the work on the RAISE Act and others, we've seen more and more interest on the part of members of Congress. You saw it at the beginning of this program. I think we're high on the awareness scale. People understand family caregivers. There are millions of them. Most of us in this room probably are or getting ready to be one. Now what we have to do is push for action at the federal level in order to help family caregivers in the category of providing resources, perhaps technology, things like telehealth, but also helping them with the financial burdens. And at least two pieces of legislation that we support have been mentioned today, the caregiver tax credit and a proposal that it would allow people to use their HSAs or FSAs to pay for caregiving expenses.
Lance, what do you think about that idea, the tax incentives or tax credits that we've heard a lot about today? Do you think that those go far enough in making a meaningful difference, or do we need to look at changes that are broader and more systemic?
Certainly, it's one more tool in the toolkit. It's not the solution, but it can be helpful. And I do think back to what Nancy was commenting, the appetite within Congress, and then how do we make sure that as a federal partner, the federal partner is really leaning in here. We've seen, of course, back in the day, the establishment of the National Family Care Support Program, the RAISE Act. We've seen some legislative opportunities, but for me, it really, though, and I'm sure I'm speaking to the choir here, for me, it's really about how do we get better appropriations to support this. You know, that's the struggle. I think we probably all acknowledge we continue to live in an ageist society where at the end of the day, we're just kind of nibbling around the edges of this issue. And if we really wanted Congress to step up, I'm grateful for what we're seeing, but I would love to see just an enormous appropriations commitment that says, you know what, this caregiver issue is so profoundly critical to our country that to really prop up that long-term support piece that we're not paying for, as members of Congress, we believe we need to better invest in respite and coalitions and all the sorts of things that are out there that I think could help, at the end of the day, drive better financial support for the caregiver.
Melissa, what about the HSAs and FSAs? They're employer-sponsored. Do employers think that would be great to let, instead of it going to, take care of some of your own expenses or your children's, use it for taking care of an aging parent, an aging uncle or aunt or other family member?
Absolutely. And I'll say, like AARP, we are very supportive of legislative efforts on the Hill to provide, some mitigation of the financial strain that employees have, whether it's in the form of tax credits for caregivers to use towards the care of their loved ones or themselves, or, the IRS came out with guidance. It doesn't even have to be done legislatively, which is common sense, which says if an employer is using a care.com type tool or a patient navigator type tool to help their employees find care, that they shouldn't. It's basically a clarification of how the tax is calculated, whether it's tax imputed or not. But essentially, at the end of the day, the guidance would give more flexibility to employers to be able to cover that benefit and give people access to this kind of navigation tools. All of these things are very common sense. HSA dollars is another thing. That's totally common sense. HSAs were created in the Medicare Modernization Act over 20 years ago. At that time, I was working on Capitol Hill, and I'll tell you how far we've come in terms of advances in care and technology. I worked for a committee, they issued me a BlackBerry, and it was the size of a pager. And that was primarily how I did my emails and communications with folks. So I'd be walking to a meeting, and I got really good with one thumb, and it's not surprising it has arthritis now. But all of that said, and I was so mad when they took it away, and I had to go to a bigger BlackBerry. And then they took away the BlackBerry, right? So the point is, when this was created, lawmakers aren't perfect, and they're looking at sort of the evidence in front of them at the time. And that's why employers have more flexibility to test things and do things. But unfortunately, when it comes to HSAs, there are tax rules, there are rules in place that were put in place when the HSAs were sort of born as part of the Medicare Modernization Act. And so it's a snapshot in time. Your ability to really leverage those HSA dollars as a worker is hampered by some of these outdated sort of rules. And so
Congress has to step in.
Congress has to step in, unfortunately, because they would have never envisioned probably being able to use for HSA, a high deductible plan with HSAs coupled could provide first dollar coverage for telehealth services. Thankfully, Congress recognized that's a really important thing and it's working really well. So they made that permanent. They made that fix permanent this year. There's so many more fixes to the HSA flexibility and modernization that need to occur. One of them is the ability to use those dollars towards caregiving needs. 100% agree. 100% agree with Nancy and Lance.
Nancy, America's Caregivers, and this is a pretty striking figure, provide some, and I'm sure you know this, $600 billion in unpaid care. $600 billion every year. I mean, that's astonishing. And I know AARP has advocated that they be recognized as part of America's care economy. Why is that important? Why would that, what kind of a difference would that make, and what steps do we need to take to make that happen?
Well, I believe, AARP believes that family caregivers are the new provider care in the medical system. And it's important to recognize them in a number of ways. One is to provide the kind of information resources that people need in order to help their loved ones. Second, more and more caregivers are providing medical tasks in the home. I tell this story. My husband had ALS, and by the way, anybody who thinks you have to have girls to take care of you, sons are good too. My two sons and I, and paid family caregivers, took care of my husband. He had a feeding tube installed but didn't use it right away, and so we got training about a year before, and when it came to actually helping him, we ended up using a YouTube video to show us how to do it. Now, I'm a big fan of YouTube, but it probably isn't the way we should be training people to do medical tasks in the home. So recognizing caregivers, and CMS now does, to provide support to doctors, nurses, to show them how to use this equipment is hugely important. And then the fact of the matter is, everybody, I think, this morning has mentioned that we're doing things here and there. Mm-hmm. We're not addressing what is a huge challenge on the horizon, and the importance of family caregivers in not only that solution, but also in the application of anything that's enacted is going to be crucially important.
So not only can sons be great caregivers, but so can grandsons, right, Lance? You were the caregiver for your grandparents,
well,
who raised you.
In my case, sons.
Yeah, well, but it's pretty astonishing. I mean, you were
Yeah.
a young adult, and figures show that today 12 to 18% of caregivers, excuse me, are younger adults. So,
Yeah.
are you optimistic, looking where we stand today and how things have changed, that the way forward is going to be easier for them today than it was for you decades ago?
Oh, certainly, yeah. I mean, I think now, thinking back 30 years ago when I was a caregiver, very little information in place, and really not an acceptance for reaching out for help. It was sort of just an expectation that you took care of it. It was your family. And nowadays, as we all know, there are quite a few resources out there. Society is better understanding, embracing, supporting caregivers. So certainly I think the pathway can be better. Doesn't make it easier necessarily, but at least I think a lot of caregivers today of all ages do have access to a lot more resources and information. I think, though, we all best learn from others and their experiences. So I also hope that we can continue to see, better connectedness across the caregiving network, so that as people are going through a situation like that, they're encountering, fellow community members or church members or wherever their social network's at who have gone through it, who can also step in. And I think, again, that is much more acceptable now and common than it was, back in the 90s.
Melissa, you've said several times this morning about how employers the workplace can be a great testing ground for new ideas. Do we need any policy changes to make that easier?
I would say probably the HSA policy changes, very important. The fact that we now have first dollar coverage of telehealth, if you'd asked me 6 months ago before that bill passed, I would have said, do that right away. But I think that if anything, the danger is that folks may try to over-regulate and get in this space, and then suddenly employers, which is what we've unfortunately, I think, seen in a bit with the paid leave space, right, where you have states all sort of popping up and doing their own sort of paid leave programs, when employers may already be offering a paid leave program that makes sense for their workforce. Now they're looking at a patchwork of different requirements. And so it's not that they don't want to do paid leave, they are doing paid leave, it's just making it incredibly hard to sort of turn the dials to be, compliant with whatever state may have their own sense of what that should look like. So I think preserving the flexibility for large employers to offer nationwide benefits is key. And again, they have their own sort of mandate, a business mandate to do this because they can't afford not to do it. They need the workforce, and they've invested in the workforce, and they want to keep the workforce. And so it's funny you asked if it's changed since Lance was a caregiver. So I'm a sandwich person, right? And that doesn't mean I just don't like salads. I'm actually a sandwich caregiver. I have a 10-year-old daughter, and I had a mother who passed this fall from MS. She had MS for 25 years. She died in her home, my childhood home, because my dad has a patchwork of caregiving assistants. My dad being her primary caregiver for most of the time that the disease progressed. My dad himself, who's in his late 70s, was diagnosed last year with Parkinson's. So in the last year since my mom has died, he also cannot now be left alone in the house, but he insists that he's going to die in his home. And so her caregiver that came in to help her now comes in on a daily basis to help him. But what do you do when that caregiver gets sick? So this caregiver had breast cancer and had to have some medical interventions. So then it was on me to come home and stay with my dad. Fortunately, my employer said, you know what, do it, we support you, you can work remotely. And that's the kind of interventions I think we have now. In addition to the telehealth and HSAs and all these things, the employer trusting their employees and investing in their employees in a way that says, we want to keep you happy, we want to meet you where your needs are, tell us what you need. And it's, there's a lot of employers that are doing employer support groups and caregiving training webinars and all of those important internal supports. But I think it's really, and what you'll see from this Mercer study I mentioned, the highest demand that workers have when it comes to their employers on how to make this work is the flexibility, the flexible work location, the flex hours, and obviously the training.
And did I get a sign that we have questions? All right.
Sure do. I have an audience question
So
from
these were submitted earlier.
Anya. What are the best sources of information for families right now? Is that area agencies on aging, perhaps state entities, et cetera?
And the question is?
Best sources.
What are the best sources of information for families right now? Is that area agencies for aging or perhaps state entities, et cetera?
Who wants to take that?
Yeah, a couple of people mentioned earlier, AARP has a wide range of resources. If you come to our website, in addition to Prepare for Care, which I think Gary mentioned, we have a number of resources. We also know how important it is to get local information. And so we have a partnership with United Way of America, and in almost 100 cities now and soon to be expanded, we have a partnership with 211, where if you call, you're able to be directed to resources in the community. And we urge folks, also the area agencies on aging, and many of the hospitals in the community, particularly in rural communities, are available to provide some kind of basic information. The other thing, I don't know if you found this with MS and Parkinson's community, but I found the ALS Association had some very specific guidance for dealing with someone with that particular disease, and I think that's very important. I remember we had some information on our website that was really geared to folks who were treating people with Alzheimer's and worried about them wandering away, et cetera. And that's not a problem if you're dealing with people who can't move. And so it's really important, I think, to get the general information. AARP is a terrific resource for that, but also to look to other channels as well.
Thank you. More questions?
One more from Dana. A person with heavy care needs who is cared for at home needs 3 shifts of home care workers plus some skilled services. This is an immense cost. Why not make congregate living and nursing homes pleasant places where people can have companionship and high quality care with savings from health workers being able to take care of multiple residents?
Lance?
Well, that's a loaded question. and I do think, the person asking the question has obviously an obvious interest in better seeing congregate options, and I think more of those are coming online. They're slow, and I do think that the majority of us still understand the nursing home industry in general is not as fondly received for your care option as a community-based option would be. But we are seeing more and more of that, and in some cases it's because if you think about some of the population and groups we serve generally across the country, not just older adults, but people with different sorts of disabilities also require similar types of care and have different types of care situations that can also be a companion option. So I don't think there's a way to sort of all of a sudden merge the system into a single type of congregate care setting, but that can always be an add-on, such as like adult day. You know, there are a lot of adult day centers across the country, and that can be a nice option during core hours of a work day that offers some respite and then some great socialization.
We just have a couple of minutes left. I'd like to give you each, Nancy, starting with you, maybe a chance to share your final thoughts as you look forward. You know, I know we've come a long ways, caregiving in the last 10 years. Are you optimistic, hopeful, concerned?
I'm always hopeful, and I'm always optimistic, and I think gatherings like this, the opportunity to hear ideas people have and willingness to get behind them is encouraging. And anybody who's in the room or on the line, we'd be happy to have you help us advocate on this issue.
Lance?
Thank you.
Yeah, absolutely. I would say that my challenge really becomes, at the end of the day, a personal one, because we over leverage what's the federal government's responsibility, what is the public sector's responsibility, all these wonderful community-based organizations that are often you know, poorly funded and not properly staffed. Those are all pieces, but at the end of the day, the best option is an individual by individual, household by household approach. So my question, my challenge, my closing comment would be, what are you doing to sort of protect your family from what inevitably will become a caregiver situation in your family? Are you having those advanced conversations now? Are you, they can be a little painful, but how are you making sure that your family is prepared and ready? As our caregiver said, if you take the steps to do that now, your family's going to be in a better place. And if we could do that, Robertson household and on down the line, we're going to be in a better place than just relying on others doing this for us.
Melissa?
Yeah, I think it's an interesting question, because I believe, you know, for several decades now, we've known that there would be this baby boomer population coming. And I think policymakers have generally approached it as a federal payer reimbursement healthcare delivery question. How are we going to provide healthcare services in an affordable way to that many more people once they retire? What was kind of missing from the conversation, although there have been sort of starts and stops around things like money follows the person and community-based home and community-based services, albeit in Medicaid specifically, is really this concept of how are we going to take care of the people and the caregiving aspect when they all do retire and they do have children or grandchildren they have to rely on, and then how do we support those people to help them? It's a big and complicated question that I'm very encouraged to see lawmakers and stakeholders of all sides wanting to come together and try to build in the right incentives and the flexibilities to allow employers or federal programs to really address this, whether it's funding some things or giving employers the flexibility. But I guess that's where I see the movement, and I'm encouraged by that. I don't think we're going to solve it overnight. Unfortunately, there are a lot of people that are suffering because of that. I mean, some of these questions, like what do you do when you need 3 shifts and you can't afford private care in the home and your father won't go to assisted living? What do you do? You know, so going to a community-based service and asking for help, leveraging, go to your employer, go to your HR department if you're working and you're a caregiver and say, what can you help me find? They will offer navigation services for you. They will provide you with community services that might be appropriate where you live that you can tap into. They may work with you on your work schedule or your work hours. And, you know, there's some of these programs you talked about, like they just didn't exist like a few years ago, but, you know, employers reserving seats at childcare centers and adult daycare centers. So, you know, don't be shy, I guess, and I'm glad to see more and more people being more empowered to really talk about caregiving, that it's not an insular family issue anymore. It really is a community issue. It really is an employment issue. It really is a higher health policy issue.
Well, Melissa, Nancy, Lance, thank you so much. That brings us to the end of our program today. Thank you to all of our fabulous speakers. Thank you to folks watching online, and thank you to everyone here in the room. If anyone missed, and thank you to our sponsor, AARP, for making this all possible. If you happen to miss anything, or you're in the room like, I missed what that person said earlier, this entire program will be available online at thehill.com. So thank you all. Have a wonderful day, and stay warm out there.
Thank you.
Take care.